Hi everyone, my name is Caitlin Snodgrass, and today I'm going to be talking about the bill of SB 504, which is the title is Communicable Diseases in HIV Reporting. To start off with the bill's summary, basically, as I just said, the full title is Communicable Diseases, HIV Reporting. The sponsors are listed right here on the page, and then just a summary of the bill. Basically, it's allowing regulated HIV patient information to be shareable to care providers and local health officials to promote linkage, which basically means after somebody gets diagnosed with HIV, helping to make sure they have the right resources, and then also care programs and bridge jurisdictional gaps between communication and public health, as well as renewing and refreshing any updated information or whatnot in patient files. So the California technical aspects of policymaking in general, basically, first off, a bill is going to be introduced, then it's going to go to the Senate committee hearings. If there are amendments that are proposed, they'll be proposed here, and then it will have to go back through the Senate hearings again, as we can see this like offshoot um, side of the proposed amendments in the green over here. And then once those amendments are agreed upon, it'll get passed through the Senate and head to floor votes. If it makes it past floor votes, it'll go to the Assembly committee hearings. If not, if it doesn't get past floor votes, it can go back into proposing more amendments and then back to the Senate hearing. Um, but assuming that it does get passed through the floor votes, it's going to go to the Assembly committee hearings. And then same thing here, more amendments could be proposed. And then once they're agreed upon, that will go back to floor votes again. And then once it gets passed through that round of floor votes, it will go back to the governor and wait for his signature approval. And after the governor signs it, it's officially passed as law. So that's just how it ends up working. So the importance of incorporation of feedback in policy making. Basically, in general, policy makers might think they know what's best, but when stakeholders in the public get a say, they can better confirm what they're doing and will actually have a positive effect on citizens they're trying to help and systems they're trying to regulate. So it's important to get collaboration from multiple fields when policies are being made. So key stakeholders are important because to get their feedback, testimonials, and amendments will be super valuable because they are the people who are being affected by the bills and who are either supporting or rejecting the passing of the bills. So policies can be refined from taking out clauses or even just changing wording to better support the community as the ultimate goal. And this would be something that the stakeholders would be able to help perfect. And then we also have community partners, which can give sort of just a better idea, and they're also directly affected by the bill. This would be helpful for legislators to define the terms more clearly. For example, for SB 504, this would consist of like healthcare providers and people who live with HIV would be the community partners that would have an influence on this bill and the passing of it, people that are outside of the politics, but are still being affected. So then political collaboration, basically, and feedback in policymaking is pivotal for creating policies that not only work and succeed, but also support the population without causing harm to anyone. It provides space for checks and balances as well as ethical considerations. So the feedback that was specifically given to SB 504, this is just some of the amendments. It actually went through a lot of amendments in a very fast process. Basically, the bill was introduced in February of this year, and it is currently awaiting the governor's signature. So it has gone through both the assembly and the committee and just has been passed, but with a lot of amendments. So it was passed with 3+ amendments, was read multiple times in both the assembly and Senate. A few hearings had to be postponed due to the amendments, and then after amendments were made, the bill passed with overwhelming support. So it was definitely a bill that needed to happen. It was just how do we make it sound right and make sure that there's no loopholes that anyone could find and make sure it's safe for everyone. And that is what the amendments were able to do. So this diagram here sort of shows kind of the process of the original amendments on the bottom and then amendments um, like prior, and then it goes to the final product and basically just shows sort of a weird small visual of how things get streamlined when they become the final product, which is a result of collaboration, which is always good. So the role of research and evaluation, basically this is extremely important for any bills or policies that are being passed, but research and evaluation are invaluable to the bill passing process and all policy creation in general. Research's influence on policy making in general. Basically, the CDC has identified through their research that surveillance is an important aspect of preventing the spread of HIV. It can help provide resources and support early on in diagnosis. So, um, that's a big part of research that's influencing this policy. And then both the CDC and surveillance research has also showed that there can be significant benefits for treatment with patients who have good linkage and sustained care. So it is just going to better treatment overall. And then evidence-based practice affects policy implementation. Basically, healthcare policies are often formed following the presentation of compelling epidemiological or public health associated evidence. So that's really important. And then the goal of the SB 504 bill is supported by evidence that shows that without adequate linkage, the support for those diagnosed with HIV, they are more likely or knowingly to spread it, knowingly or unknowingly. And then how is research finding influence policy implementation in the past? Basically, policymakers need research finding to help them create systems and interventions to address problems in public health. For example, there was a Ryan White program. This is just a random example, but ended up using evidence-based research to show how important linkage and re-engagement methods were to slow and stop the spread of HIV in the community. So that is definitely a big part of research that is connected to this whole thing. So ethics and policy making, basically, this is one of the most important applications of policy is that it needs to fall within the ethical boundaries. Basically, the core ethical values in relation to this bill specifically are going to be professionalism and trust, which public health agencies must promote trust so that the populations will align with their research of what is best and they can build trust by being both professional and scientific. And then health justice and equity, the healthcare that is provided needs to be equally accessible to all who need it without stigmas attached, which basically that ethics will ensure that. So then confidentiality versus enabling in public health action. Trust between patients and healthcare providers must be preserved. People already living with HIV must be equitably treated. And then this bill needed to be properly restricted and use specific language so that it could not be easily taken advantage of. And this is why there were multiple amendments that were made, but it ensured the confidentiality, so it was totally worth it. And then basically more ethical considerations for policies in general. Basically, the APHA Code of Ethics should always be considered when policies are being analyzed in general, and these policies should be brought through a thorough ethical examining that looks at making sure the following values can be a part of the outcome. And basically, that's going to be the ethical values of permissibility, respect, reciprocity, effectiveness, proportionality, accountability, and transparency, which are all things that we have learned through this course this semester, and are definitely important to apply to ethical situations. Then potential ethical dilemmas with this situation, basically the biggest one is just going to be privacy of the patients. Is it truly secure, or does this pose a risk of information being leaked or misused? What are the safeguards that we would have to prevent that? And then it must establish justice and not allow for permissibility when it comes to transfer of confidential medical information. So those are things to watch out for, but also things that the amendments did address, which is good. So then demonstration, basically this is an example of what the actions in processing the bill to become law consist of. The bill had to be amended many times to fine tune the way that it worked, as I've already said before. Um, Basically, it is still just awaiting for the governor to sign it. But as you can see here in this top graphic, we can see the dates of when it passed through either the Senate or Assembly. And when it had to go back to the floor, you can see there's 3 different floor analysis on here. And that's because of the amendments. Or actually, sorry, there's 4 different floor analysis, which basically means it had to go back to the floor for a vote 4 different times because of the amendments. And then we can see on this bottom here, we can see all the different stages that it went through for both the Senate and Assembly. And we can see here at the end that it actually did pass, which is super good. Now it's just waiting for the governor to sign it. So this was the infographic that I did. And basically it doesn't have obviously all of the information, but it has a quick summary and overview just for someone to be able to learn really quickly what's going on. But basically on this left-hand side, the front page, we have a link to the full bill site, which is perfect where people can find more information. That's that QR code in the top right. And then we have SB 504, communicable diseases, HIV reporting. And then we have basic information, the goal for public health, evidence that supports it, and then objectives and outcomes. Basically, all of this information is going to be helpful for somebody to read and understand quickly what the bill is supporting and what evidence supports it. And then on the far right-hand side, we can see the status is passed in the Senate and Assembly, and it's awaiting the governor's signature. So immediately, whoever's reading this can know where the bill stands and what part of the process it's in. But then if we look on the right-hand side, or what would be considered the back side of the infographic, we can see in this top right corner, sort of a simple visual of how bills pass through and get put into the law. So we have the bill introduced, the committee hearing, the committee hearing again, and then 4 votes in there, and then passes with the governor's signatures at the end. So we can see there's check marks by all of the steps except for passes with the governor's signature because it's currently awaiting the signature. And then we also on this page have stakeholders, as well as advocacy and call to action for whoever is reading this. And then we also have some pros and cons, which is just important to weigh the differences between them. And yeah, then we have the ethical critique and possible amendments that could help the policy become better or be a little bit more protected. So this is something that would be really helpful for helping people in public health or not in public health be educated, and then also be able to share what they know about the bill from there, and get a quick and easy understanding, while also having access to more research if they decide or want to do more research. And as we can see in the bottom left side of the left paper, there's a QR code where we can find the works cited for the sources here, where someone would be able to read the articles that have been referenced. So yes, this infographic would be super helpful in general. So conclusion overall, the goal of the SB 504 is to allow healthcare professionals of a patient who has already been reported to the state as being positive for HIV to disclose this information to the county health department when necessary to supplement case reports, investigation, control, and disease surveillance. The SB 504 bill does a good job of representing the process, which bills are passed in state legislature and how they require evidence-based research, as well as feedback from stakeholders. And having an ethical foundation for policies ensures that they'll actually be helpful to the population instead of harmful. And then infographics can be used as a tool to help diverse community members understand and better engage in the policy-making process, and also just to raise awareness and cause just the asking of more questions and desire to learn more. So that's always going to be very important for public health. So yeah, here's my works cited, and thank you so much for watching. Have a good rest of your day. Goodbye.